Welcome to the Deep Dive. Today, we're unpacking a topic that affects millions globally, colorectal cancer.
Yeah, it has a really profound impact on health worldwide.
Absolutely. It's something we all need to understand better, not just for ourselves, but, crucially for the people we care about.
That's exactly right. Our mission today in this deep dive is really to cut through the noise, give you the essential facts. We want to zero in on the critical risk factors, the symptoms, and maybe most importantly, highlight those vital strategies for prevention, early detection, and treatment.
Right.
And we're pulling this directly from comprehensive info provided by the World Health Organization, the WHO. So you know you're getting accurate, actionable insights.
And hopefully your journey through this with us will be a bit of a shortcut to being well-informed.
Yeah.
We want to get right to the core of what matters without, drowning you in jargon.
Exactly.
You should walk away with some perhaps surprising facts, but definitely practical takeaways that can really make a difference.
Let's hope so.
Okay, so let's kick things off. Let's zoom in on the sheer scale of this. The numbers for colorectal cancer are, well, they're striking.
They really are.
It's the third most common cancer worldwide. Makes up about 10% of all cancer cases.
Yeah, about 1 in 10.
But here's maybe an insight people miss. While the burden is huge and growing, the good news is that so much of its impact is actually preventable, or at least manageable if caught early.
That's the critical part.
This isn't just a statistic, it's really a call to action for what's often an avoidable tragedy.
And if that doesn't quite hit home, consider this. It's also the second leading cause of cancer-related deaths globally.
The second. Wow.
Yeah. In 2020 alone, that meant over 1.9 million new cases, and tragically, more than 930,000 deaths linked to it.
Nearly 1 million deaths.
And what's really striking from a global health view is how fast this burden is expected to grow.
Right, you mentioned projections.
Yeah, by 2040, new cases are estimated to surge by a staggering 63%, up to 3.2 million per year.
63%.
And deaths, expected to jump by 73% to 1.6 million per year. That kind of trajectory, well, it demands our attention.
It really does. And when we look at who it affects most, it's predominantly older individuals, right? Most cases in people 50 and up.
That's correct. The majority, yeah.
So understanding this isn't just about numbers. It's about empowering ourselves, our parents, our friends, anyone in that age bracket, really, to safeguard their health just by being informed.
Absolutely. So maybe let's clarify first. What is colorectal cancer, basically?
Good idea.
Simply put, it's a type of cancer that develops in your colon, which is your large intestine, or your rectum. Both are key parts of your digestive system.
Okay. And you mentioned earlier it's kind of insidious, stealthy.
That's a good word for it.
Yeah.
Yeah, many people won't have symptoms in the early stages.
So it often gets diagnosed later.
Often, yes. At more advanced stages, when treatment options can unfortunately be more limited.
That sounds like a huge challenge. So how do we catch something that often hides like that? What are some key things to look out for?
You're right, that stealthy nature is a major hurdle. But while early stages can be silent, there are common symptoms that can appear as it progresses. It's vital to recognize them, not just brush them off.
Like what sort of things?
Things like persistent changes in bowel habits. So new or worsening diarrhea or constipation. Maybe noticing your stool is narrower than usual.
Right.
Any blood in the stool is a definite red flag. Could be bright red, could be dark and tar-like.
Right. Don't ignore that.
Definitely not. Other signs: abdominal cramps, pain, bloating that just doesn't go away. Unexplained weight loss is another one.
That's trying.
Exactly.
Oh, wait.
Also, feeling constantly fatigued, really tired. And sometimes iron deficiency anemia, which happens because of chronic hidden bleeding.
It's unsettling how many of those things could seem like something minor, isn't it? Like just an off day or feeling a bit tired.
Precisely. You might think, oh, just a bad stomach day, or I'm just run down. That's why awareness is so critical.
Absolutely. Okay, so we know what it is, how sneaky it can be. But for people listening, the question often is, what puts me at risk? What are the key factors here?
Well, age is definitely a primary factor. The risk goes up significantly after 50.
Why is that? Just wear and tear.
Partly, yeah.
Yeah.
Our cells accumulate more changes over time, increasing the chance of some turning cancerous. But it's not just about getting older.
And family history plays a big role too, I imagine.
Huge. If it runs in your family, especially if there's a history of specific genetic conditions like Lynch syndrome.
I've heard of that.
Or FAP, familial adenomatous polyposis, your risk is much higher. These are conditions where abnormal growths, polyps are much more likely.
And what about personal history, if you've had it before?
Yes, a personal history of previous colorectal cancer or even certain types of polyps puts you at higher risk for it coming back or new ones developing.
Okay. So age, genetics, personal history.
Right.
What else?
Then we get into lifestyle factors, and this is really significant because these are often things you can change.
Right. Modifiable risks.
Exactly. We're talking about things like a high intake of processed meats.
Like sausages, bacon.
Also, a diet low in fruits and vegetables, leading a sedentary lifestyle, not getting enough physical activity.
Okay.
Obesity is another factor, smoking, definitely, and excessive alcohol consumption. All these can contribute quite substantially.
But the flip side, as you said, is that gives us a powerful avenue for prevention.
Precisely.
So with all these risks and the sneaky nature of the disease, it could feel a bit daunting.
Yeah.
But this isn't just about understanding the problem, right? It's about empowerment. How do we actually fight back?
Exactly. Let's talk about the proactive side. Primary prevention strategies are your first line of defense.
What does that involve?
It means adopting a healthy diet, really rich in fruits, vegetables, fiber, staying physically active, making sure you don't smoke tobacco, limiting alcohol consumption, and trying to avoid exposure to known environmental risk factors where possible. These sound like general health principles,
Because they are.
but they have a direct impact on colorectal cancer risk.
Okay, so that's primary prevention. But you also mentioned catching it early. Secondary prevention.
Yeah.
I hear a lot about screening. How significant is regular screening?
Oh, it's incredibly significant. This is where it gets really transformative, actually.
How so?
Well, screenings can dramatically reduce both the incidence, how many people get it in the first place, and the mortality, the death rate.
Right.
And the key is they allow for not just early detection of cancer, but also the removal of precancerous growths, polyps, before they even get a chance to turn into cancer.
That's the real game changer, isn't it? Stopping it before it starts.
Exactly.
And the good news is there are convenient ways to do this, right? It's not always invasive.
Correct. Stool-based tests, like the FOBT fecal occult blood test, are a great starting point. They're non-invasive. You usually do them at home.
What do they check for?
Hidden blood in your stool, basically, which can be an early sign.
Okay. And if that comes back positive,
Then, usually, further diagnostic procedures are recommended, like a colonoscopy. This lets the doctor get a direct look inside the colon and rectum.
and that's considered the gold standard.
It is, yeah, because it allows for both visual inspection and immediate removal of any polyps they find during the procedure.
Two birds with one stone, sort of.
Kind of, yeah.
And what about people with that strong family history we talked about? Or genetic risks?
For those individuals, genetic counseling and testing can be really important. It's a proactive step to assess their specific risk level and figure out the best, most tailored screening plan for them. Maybe screening earlier or more often.
Makes sense.
Yeah.
Okay, so screening is key. What happens if, despite screening or maybe because of symptoms, cancer is suspected? How is it diagnosed for sure?
Right, so diagnosis involves several steps. Usually starts with a physical examination, then imaging things like ultrasound, CT scans, MRI to get pictures of the inside of the body.
See where I'm being.
Exactly. And then direct examination of the colon, usually via colonoscopy or maybe sigmoidoscopy.
And the crucial step.
The biopsy. Taking a small tissue sample during the colonoscopy for examination under a microscope. That confirms the diagnosis, is it cancer or not?
Okay.
And then increasingly important is molecular testing on that tissue sample. This helps identify specific genetic mutations in the cancer cells, which can really guide the most effective treatment plan, personalize it.
Right, personalized medicine. So once it's diagnosed, what are the treatment options? You mentioned quite a few earlier.
Yes, there's an impressive array of options now, thankfully. Surgery is often key. Then there's radiotherapy, chemotherapy, targeted therapy, and immunotherapy.
Quite a toolkit.
It is. And what's really critical to remember is that early detection consistently leads to much better treatment options and ultimately better outcomes for patients.
Makes sense. Catch it early, easier to treat.
Exactly. The approach really varies depending on the stage of the disease.
Okay, can you break that down a bit? Early stage versus advanced.
Sure. For early stage disease, meaning the tumor is just in the bowel wall or maybe nearby lymph nodes but hasn't spread far, the main treatment is surgery.
To remove the tumor.
Right. Remove the tumor and any affected lymph nodes nearby. That might involve a colectomy, removing part of the colon, or a proctectomy for the rectum.
Does that sometimes mean A colostomy bag?
In some cases, yes. It might lead to a temporary or sometimes a permanent colostomy or ileostomy. That's where a surgical opening is made to divert waste. It sounds daunting, I know, but these are often life-saving procedures.
Okay. What else for early stage?
Sometimes adjuvant chemotherapy is recommended after surgery, especially for patients considered high risk.
To mop up any remaining cells.
Exactly, to target any microscopic cancer cells that might have been left behind. And occasionally you might have neoadjuvant chemotherapy before surgery.
To shrink the tumor first.
Precisely, makes it potentially easier and safer to remove. And radiation therapy can also be part of the plan, particularly for rectal tumors.
Okay, that's early stage. What about advanced disease? Metastatic cancer.
Right, so when it's spread to distant organs, that's metastatic disease. Here, systemic therapy becomes the main approach, treating cancer cells throughout the body.
Like chemo.
Combination chemotherapy regimens are very common, yes. But what's really exciting now is the rise of precision medicine.
Targeted therapies.
Yes. Targeted therapy might be an option if the cancer has specific genetic mutations, like KRAS or BRF. These drugs specifically attack those cells.
And immunotherapy.
Immunotherapy drugs can be considered too if the tumor has certain genetic markers like being MSI high or dMMR. This basically helps your own immune system recognize and fight the cancer.
Amazing. Is surgery still an option with advanced disease?
It can be. While systemic therapy is primary, surgery or other localized treatments, things like radiofrequency ablation, cryoablation radiation, might still be used for specific metastases, maybe in the liver or lungs or just to control symptoms. It's about tackling it from multiple angles.
Sounds like a very complex picture needing lots of different experts.
Absolutely. Multidisciplinary care is vital. Having doctors from surgery, oncology, radiology, pathology, all working together on a treatment plan.
And what about just quality of life?
Yeah.
Managing symptoms.
Hugely important. Supportive care, or palliative care, is crucial. It focuses on managing symptoms, providing pain relief, offering emotional and psychological support. It improves quality of life for the patient and their family throughout the whole journey.
That support must be invaluable.
It really is. And one other thing worth mentioning is clinical trials.
Right, for new treatments.
Exactly. They offer patients access to potentially novel therapies, things still in development, and participating helps push the boundaries of medical knowledge for everyone. It's how we find future breakthroughs.
So all these individual efforts, prevention, screening, treatments, they fit into a bigger picture, right? A global response.
Indeed. This isn't just an individual fight. The World Health Organization, the WHO, is deeply involved.
How so? What do they do?
Well, they work on multiple fronts. Raising public awareness is key. Developing and helping countries implement large-scale cancer prevention and control programs.
Like screening initiatives.
Exactly. Initiating early detection and screening programs, especially where they're needed most. Strengthening health systems overall, building capacity, particularly in lower resource settings.
So doctors and nurses have the training and tools.
Right. They also conduct vital research and surveillance tracking the disease globally, and they foster international collaboration and partnerships, bringing countries and organizations together.
That sounds really comprehensive.
Yeah.
Like their work on primary healthcare systems, making screening more accessible everywhere.
That's a great example, yes. Making sure the infrastructure is there.
So what does all that global effort mean for us, really?
Essentially, these comprehensive efforts by the WHO aim to significantly reduce the burden of colorectal cancer worldwide.
Wow.
By promoting prevention, ensuring early detection happens more often, facilitating equitable access to quality care so it doesn't matter where you live, and just improving overall cancer control globally. It's about building a strong global framework to tackle this disease head-on.
Okay, so wrapping things up a bit, understanding colorectal cancer from the risks and symptoms right through to the huge impact of prevention and early detection. That really is crucial knowledge for you, the listener.
It absolutely is. It's about being informed and feeling empowered to take action for your own health.
Because knowledge empowers action, right?
Exactly. True knowledge isn't just having the facts, it's about driving actions that genuinely lead to better health outcomes. And what's exciting, I think, is how much ongoing research in these global health efforts provide real hope for the future. Things are improving.
That's good to hear. So as we think about those projections, though the increasing numbers expected by 2040, here's a final provocative thought for you to consider.
Okay.
How might advancements in personalized medicine, maybe things like AI-driven tools for even earlier detection, could they fundamentally change the story around colorectal cancer?
Interesting question.
Could it transform from being a leading cause of death into something largely manageable? And maybe more personally, what role could you play, even if it's just being informed and proactive yourself, or advocating for these advancements, or simply making sure you and your loved ones are aware and engaged with their health? Something to think about.